We're starting. Welcome, everyone, back to Digital Health Talks Hannover in 2025. So great that you tuned in again. I hope you had a great start into the new year and that right now it hasn't been so busy. Apparently, you take the time to listen to our talk today, which is a good sign. As you noticed, the ones who've been here before, we changed the time. We are now lunch talk time, 12 o'clock for the new year, new concept. If you think that's great, we're very happy to get your feedback on it. If you think it's not so great, we're also happy to hear about it. My name is Cornelia Bentrup, and I'm Project Director at hannoverimpuls. This is the economic development agency of Hannover and the region. Here, healthcare is one of our major topics, and we initiated and we run the Digital Health City Hannover project. This is all about empowering the local ecosystem in Hannover, connecting it abroad, having a big and interactive community, different innovation projects. And one of the projects that we do is the Health Innovation Space that we will hear a bit about today in the topic of digital interpreters. So imagine yourself being a patient in a hospital. This is today like a global village. There are numerous languages happening between staff and patients. And you wake up after surgery, and the language you speak is not the language the healthcare personnel speaks. But you would like to ask for a glass of water or for some painkillers, and they don't understand you. That is not an ideal situation. Of course, digitalization can help. We know this in our private lives already with functions. How about if that works in the healthcare profession as well? Having a digital interpreter that connects the communication between people not sharing the same language. This is something that we are testing and currently running in our innovation project. And the technology comes from a company based in Gothenburg, Sweden, Mabel AI. Therefore, I'm very happy that one of our guests is Shahid Jabbar, and he's founder and CEO of Mabel AI. Shahid, thank you so much for joining today.
Thank you, Cornelia, for inviting.
Usually there would be now a second guest, so that is not something new that it's just one guest, but unfortunately, Nicole Bayer from Sophienklinik had to call in this morning, and she had a very urgent matter that she had to attend to, and she's very sad that she couldn't join. The one good news about it is that this project round that we were doing with the Health Innovation Space is something that I'm personally in charge of. And therefore, I have a lot of knowledge. And today in this talk, I will sometimes step into the shoes of Nicole, and I will let you know about the perspective and the information from Sophienklinik. Sophienklinik is an occupancy clinic in Hannover, meaning it's residential doctors who can book slots and times, and they are then doing and delivering their surgery, and then there is post-care afterwards. Yes, how did it all start? And how did it all start? I'm thinking first about Mabel AI, Shahid, because your background is being a software engineer. And before Mabel, you've already been quite successful running projects in the US at the famous MIT. You wrote software for Boeing that is now flying in the world, people being on planes, being equipped with that sort of software. And then all of a sudden, Mabel happened. Let us know what is the reason.
Yeah, so it was not all of a sudden, as I would like to think so. It actually started almost 15 years ago. Carolina, my wife, and who is also a co-founder of Mabel, once came home and she was very upset. She's a medical doctor and she had a duty in the ER. She came home and she said, "I can't work like this." I said, "What happened?" She said, "There was a woman who came for emergency, and she didn't speak any Swedish, English, or any other European language. She was subjected to domestic abuse and she refused an interpreter. So in Sweden, you have the right to get an interpreter, but she refused an interpreter. She said, whoever will come will know my husband, who is very famous in the community. And so since then, we have been thinking about how do we solve this problem in a very private way. Voice is a very private thing. If your journal gets leaked, which is basically just text, you can always say, I didn't say that. But voice is something that is like a fingerprint. So we wanted to create an translation system that is completely private. So when we came back from the US, where she was a researcher at Harvard and MIT, we decided to work on Mabel. And Mabel is basically offering a fully voice-to-voice translation in a private setting. It can be run either completely on device or on premise.
Yes, that we will also see quite soon. I think it's interesting to hear that you're already describing a second use case, whereas when I was introducing, I said, well, if I'm a patient and I would like to ask for help, that could be one part. You were already describing a situation. What about if I even have someone who could help and translate for me, like an interpreter, that can either be usually officially be paid and asked for by the hospital, but it can also be something that the patient brings, and quite often it's not even a professional person. I think one has to say that this often are family members. So I heard from Sophienklinik that sometimes it's the nephew, the niece, the son, the daughter who is taking over the role as the interpreter. And one part is that maybe you don't want that person to know everything because it's privacy. It's quite it's quite close to what one knows about oneself. But then also it's also quite a big responsibility, I learned. When we talked to Sophienklinik, one of the anesthesists was saying, well, we also have to make sure that what I'm saying is being translated in the right way. And
Exactly.
even though my English, I think, is quite okay, my native language is German. So if I would have to make sure that I'm translating correctly medical terms into English, that's a complete different level. So I think this is a second interesting case happening in the German care setting. I mean, it's happening in care settings all over the world.
In,
Yeah.
Indeed. And I mean, if you are looking at the this use case that you described, where the relatives or friends, they are also the other colleague doctors, they are interpreting for you. It has the biggest problem is privacy, data leakage. Also, what I've heard is that several times children are interpreting for their mothers during childbirth. That is that is traumatic for the child, and it puts the health of both the mother and the newborn at risk.
Absolutely. So therefore, I think we're already giving numerous reasons for Sophienklinik being interested in engaging in this testing round, in this innovation project, and finding out how Mabel can help in everyday situations. So I would now ask Nicole and say, what was the main reason? And we started last year in April. That was when the match between Sophienklinik and Mabel AI happened. And Sophienklinik said, we have a third reason, and it's a lot of doctors and also nurses, medical staff in general, coming from abroad, working in Germany. And even though, of course, different proficiency levels are needed, at the beginning, it is not as high as if someone has been working here for a longer period of time. So Nicole said, we're very much interested in the Spanish language because Sophienklinik had assistant doctors and nurses coming in from Colombia. And that's something that helps the staff amongst themselves also to talk. Or maybe if something happens that they're not feeling too confident about in the patient relation, you could also help and support here. So this is how we all started. And this is the case where, before we go further, Shahid, I think it's very interesting for our audience to see how does it actually work. We're not taking Spanish now. I think the language that most people understand is German and English here.
Exactly. Yeah, I bring it in. Let me know if you can see my screen.
I can see the screen. I can also hear you.
Perfect.
So this, for everyone maybe to see, this is just your desktop version of an app that can be shown either on a mobile phone or on a tablet.
Exactly. So it comes as a web app that we also have a native iOS and Android version too. This web app, all the AI models, they can be deployed directly inside your firewall. So no data ever goes out from your hospital, for example. So here I can choose the language. I pick the language of the doctor as English, but the choices that I have is Arabic, Persian, English, Norwegian, Polish, Russian, Ukrainian, Spanish, and Turkish. The same, I pick the language of the patient to be German here. One important thing that you see here underneath is the gender. That is something very unique for us, for which we have also filed a patent.
Yeah, I was just thinking because I know apps like helping me translate when I'm traveling. It's like Google or DeepL or these kind of things. And there I never have to pick whether it's male or female, but you do with
Exactly.
Mabel. So this is helping me to improve the translation, I assume.
Indeed. So, not much in English and German, but if you're looking at Arabic, Russian, Ukrainian, to some extent in Spanish too, the verb and the adjective, they change with respect to who is speaking and who are you speaking to. The other translator apps that are available, like Google Translate, Microsoft Translators, they default to male gender. And we wanted the app to be representing the real population that will be
Yep.
using it. So the
Emails as
population.
well happening to
Exactly.
patients.
So that's the reason that we picked up the gender. I will now speak something.
Show us how it works. Like, can you
Yes,
make a
exactly. Yep. So I start with starting the microphone.
Mhm.
If you have a migraine, you can take ibuprofen to relieve the pain. So what you saw first is my voice transcribed to English, and I can here verify if it worked correct, if it transcribed correctly. If not, I can always edit it. For people that cannot read, I can also listen to the audio, which is the generated audio, not my original, but the
you
generated
show
audio.
it now?
Yeah.
If you have a migraine, you can take ibuprofen to relieve the pain.
Then the next thing that you see is the German translation of it. But how do I know? If I do not know German, how do I know that this is correct? Which is also one of the problems with that you face when you're using someone else for interpretation. So what we did in a very clever way, we took this text and we translated it back to the source language, here in this case, English. It might not be exactly the same, but I can get an idea that this is what is being translated.
Yeah, right. So that is verification that if I
Exactly.
think back about the situation in the hospital, if I think about the medical staff working at Sophienklinik, of course, I really want to make sure that what I said is what's been translated. And I can see here immediately that this is a big difference compared to a human interpreter. So if my son or my niece is translating then or interpreting, then I actually, as a medical staff member, I have no idea what they say if I don't speak the language. So I think
Exactly.
this is what we heard. This is a great help to be more empowered as the person not speaking the language.
Exactly. And I mean, AI is a black box. So how do you know that all the AIs have done the job in the right way? So the first AI was that converted my audio signal into text. Here I can verify by either reading or listening. But for the translation, that was always an issue. how do I verify that the translation is correct? And with this reverse translation, now I can open the other black box, which is the translation, and see that yes, translation was done correctly. And once I'm satisfied, I can play to the patient.
Wenn Sie eine Migräne haben, können Sie Ibuprofen nehmen, die Schmerzen zu lindern.
And we are very proud of this reverse translation. We have gotten amazing feedback. Everyone that has used the app, that this has been the main game changer. And we have patented this idea.
Yeah.
So now when it comes to the patient answering, so I will try to speak some German. Und was soll ich tun, wenn das nicht hilft? And same here, I can verify if it was correct. I can look at the reverse translation. Here, it's actually exactly the same. And then I can play it to the doctor.
And what am I supposed to do if that does not help?
Great. Well, thank you for demonstrating this, Shahid. I think that made it a lot more clear for everyone to understand what your technology can do. And also to see that there are differences in services that we know from our everyday life. And you filed for patent, as you already said, so that's something that not every company can do. We have started the first testing experiences, I would call it, with Sophienklinik, where we had a couple of assistant doctors and pain nurses working with the app, and they were using it amongst themselves and also with a couple of patients. And here the idea was to check a bit UX, UI, usability, to get first experience amongst the employees at Sophienklinik. That was before Christmas, and we had a quick round to sum up. And here Nicole could tell us, fortunately I know since I was there, it was good feedback that they were saying, yes, our languages, the ones they tried, are being interpreted in a good way. They liked the play with it. They liked being able to speak to patients in a way that they couldn't before. But then it's a testing round, and I think this is something we have to make very clear here now. We have to start testing in order to find out what happens. And you showed us the little functionality with the pen. And it said, if you don't understand, if it wasn't understood correctly, for example, if ibuprofen is not spelled correctly, then you could change and then it learns. And of course, that's something that happened. Then in the project, we also had a bit of another issue. As I mentioned before, we started off being very enthusiastic about Spanish language. And by the time the software development was ready and Sophienklinik was ready and everyone was ready to go, there weren't that many Spanish speakers left. So all of a sudden, the use specifically with the patients was different languages, and it was languages that weren't implemented yet in the system. And you were very eager to help and to follow up with the requests, but of course it's something that takes time. And me coming back now to my role as the project manager, I think it's very important for everyone in such a testing round and innovation project to be aware it takes time, and there are always things happening that one cannot plan in advance. So I know that for you, Shahid, you also had to remain patient and wait. And at the same,
I mean, it's a learning experience, and we did manage to add Turkish, for example, quite fast, Turkish and Polish as the language of the patient. In our case, since we are not using any third-party API, so what I show you here is not a wrapper around big tech companies' APIs. This is something that is completely isolated. And so adding a language here means that we need to collect the data. We need to train new models for speech recognition, for translation, for speech synthesis, and then bring it in. So it takes time to bring in new languages.
Absolutely. And this everyone understood, and Sophienklinik was, of course, and is grateful that more languages are now being added. I think the second part that also came up in the testing was a bit the usability and practicality. We know that when we use voice recognition with daily devices, whether it's the car I'm talking to or my mobile phone like Siri or Hey Google or Amazon or Alexa or whomever I talk to, and nowadays we have to speak a little bit slowly and we have to speak a little bit clear. I mean, you just demonstrated it.
Exactly.
And I think some of the patients were in their situation not used to it as much, so they spoke too fast or also not directly into the device. And then there were some issues, but that's something that with communication and with training, of course, everyone gets used to. We just figured out this is why testing is important, and this is why it's used to start in a small group in that case. A third part of the testing I would just briefly bring in and is that Sophienklinik is the first clinic in Germany or the first organization in Germany that you are having such a project with, as much as I'm informed, meaning that also the algorithm hasn't had so much time yet to train the German in that medical setting, whereas, for example, the Swedish is already very much used to, because in Sweden, a big university hospital, Sahlgrenska, is already using it. What do you think, Shahid? How long would the German, how long is difficult, how much would you need to use it so that the German would come up to the same level, maybe like the Swedish is?
Very good question. So, and this is where an important thing that comes in is that it doesn't matter how long you use it, because we do not record any data. So we do not have access to what did you speak in it, what did you write, what did it translate. It's completely blinded, and that is one of our strengths, that we work in full isolation. We have no access to how people are using it. The only thing that we can improve on is that when someone explicitly sends a feedback, so we have a feedback option in the app from where you can send the feedback, and as soon as we receive a feedback, then we can get that sentence that was being spoken or being typed, and we can work on that particular translation and the reverse translation. But apart from that, we operate in complete incognito. For German language, we have we got lots of feedback from Sophienklinik from testing from Spanish to German, and mostly from Spanish to German, things that were not correct. We managed to fix that. And that is also one advantage that we have compared with using any big tech services, because it's our models, we can fix them very fast. We can also incorporate like a dictionary that is the hospital related terms. When it comes to, I would say within perhaps 2 to 3 months of good usage with continuous feedback, we can definitely raise the bar on German.
I'm quite glad you say that. I didn't ask that question before, actually, because the continuous collaboration between Sophienklinik and you will actually go on for another 3 months. Exactly. And we have planned now the big rollout. So far, for our audience to know, there was this short, smaller testing to get first experiences, also to make sure things are on the right way. And now we are rolling out over the whole clinic. And so we had a workshop also with all departments being present to think about how will we use Mabel, what are the standard situations, what could be the benefits. And that was from patient management, going over to anesthesia, to the surgical theater, to, of course, the usual care stations, pre and post-op, and then the part where patients are being released again, in the release management. And it differed quite a lot, I can tell you, because Shahid joined us for the beginning, and then we were with the hospital group themselves. And it was from patient management saying, well, they don't really know who's coming. Sometimes, of course, they hear it on the phone before, but they have to react. anesthesia was telling us that in the normal conversation, usually it's interpreters being present. And then there was one thing that was really surprising, and I know that Nicole wanted to share it here, and that was about what actually happens after, or the anesthesists, this is a difficult word, are taking the patients and bringing them into the surgical theater, because this is where interpreters are not allowed to follow. This is where patients are by themselves. And if then the medical staff realizes no one in the room speaks the same language as the patient, that's a huge issue. So then what they try to do is to find a solution, which would usually mean to make quick changes, to find someone in a different surgical theater who could switch positions. And that in an organizational procedure is, of course, not much helping, and it's costing a lot of time and stress and nerves for everyone. So they said from that perspective, it would be great to have a digital supporter, and they're very excited to see how it goes in the big rollout. And what I didn't mention yet, and that's the biggest part, they actually said it's once a day this happens. Once a day, they're facing that issue that they have to completely reorganize. So this is absolutely incredible. And then the third part I just briefly want to mention was, and that's very crucial, it was the care staff at the normal stations saying that if they face this issue I presented at the beginning, all of a sudden a patient would like to say something, they don't understand the patient, they need to ask them something, they have to call colleagues who speak that language. That means time for the person who's calling, and it means time for the person who is actually working on a different ward, leaving their ward, going to that ward, and then helping out. So another scenario where we are very curious to find out how it will work. We will start end of February, and I think results can be expected by May, I would say, and that will also be shared. I'm looking at the time. We've been, even though we're just two people, we've been chatting quite a lot. I want to ask quickly, is there anyone who would like to pose a question in the audience? If not, it's not that much of a trouble since we are running late, and I know that questions are also possible later on, so I don't see anyone raising their hand just now. Let me briefly summarize.
You can ask that if they can also ask the question in German.
Yes, absolutely, of course. And then afterwards, we go on and share the contact slides soon. I think what we learned today is that, first of all, technology is offering new solutions and is in an innovative approach, helping on so many different levels when it comes to coming over speaking barriers. And it needs, before we can do it every day and that everyone can do it, it needs time of implementation and testing. And this is something where Hannover has proven itself to be a great testing round, with Sophienklinik being brave and saying in their daily routines, they like to implement, even though they know it's going to take a bit longer and they will need to see how things work. And I think it's a time where also we as a Hannover ecosystem can be happy about us, that these things are here in our group of partners and that we can all learn from, like today, and ask questions. Shahid, thank you so much for sharing, for helping and for being here. I see now the contact slide is, I'm asking, could you maybe come stop the sharing for a second? This was my colleague helping me, because I quickly wanted to say so much thank you to Shahid that you took the time. And I mean, it's first of all being part of the project and coming from Sweden and helping us here, but also for today. Thanks for joining.
Thank you very much, Cornelia, and thank you, Hannover Impulse, for everything, for arranging this project, which was arranged in a very, very professional way, and to be that we could visit you, meet also Sophienklinik people. Nicole unfortunately could not be here, but thank you everyone for joining the seminar, and feel free to send your question. Sie können gerne auf Deutsch schreiben. Ich verstehe auch ein bisschen Deutsch. So, das geht auch.
Sure, this is a perfect moment for the contact slide. And I also know that next to Shahid, also Nicole, even though she couldn't be here today, you can reach out to her to get experiences from Sophienklinik. Then before the talk is after the talk, after talk is before the talk, the next digital health talk, Hannover, is happening non-digital. You might not believe it. There is a big fair happening at Hannover Fair. It's called ProCare. And there we will be present on the main stage, the spotlight stage. It's on February 11th at 11:30. And here we will demonstrate yet another innovation project, also from Digital Health City Hannover. It's a communication platform. Not this one, because that one will not interpret it. It will give combination and ways of working between healthcare personnel and their patient in an ambulance setting. Please come there, visit the fair, visit us at our booth, come to the main presentation. You find all information on our website, on the LinkedIn channel, in our newsletter. And if everything else fails, feel free to reach out to me, to the Digital Health City Hannover team. We're very happy to hear more from you. Thank you so much for sharing and for joining. I see took a few more minutes. I hope you could still be with us, and see you soon. Take care. Bye.
Bye.